Hi there, so in this video we're going to be looking at acute shoulder pain. So in particular we're going to be looking, so in this model of the shoulder, what you can see is the collarbone, the shoulder blade and then the upper arm. So the joint we're particularly interested in is this ball and socket joint here, so the ball and then the socket on the on the shoulder blade. So what we're going to be doing is trying to open up the space between the bone up the top here and the ball. Okay, so the first exercise we're going to be looking at is requires a weight. Okay, so I'm going to pop down the model. So I'm just using a kettlebell. This is a 4 kilo kettlebell, just something to allow the arm to be distracted. So again, that ball of the shoulder joint is getting some pull, and we're just going to start getting things gently moving. So backwards and forwards. That just starts to increase the range of motion in the shoulder, and it just reduces some of the adhesions in the shoulder. And then we can change direction and we can go side to side. So again, what we want to do is just work in the areas that working just to sort of touch onto the areas where it's uncomfortable, and increasing the range as we feel comfortable with. Okay, once we've gone side to side, we want to go in the clockwise direction. And again, we're working within a range where you're just touching on the pain. So it might be a small circles for yourself, it might be a little bit bigger. Once you've done 10 in the clockwise direction, you can do 10 in an anti-clockwise direction. So I'm just using my opposite hand just to brace against the bookshelf here, just to allow just to stabilize. Okay, so that just helps to work loose the shoulder, reduce some of the adhesions that build up whilst the shoulder is healing. The next exercise we're going to look at are isometrics for the shoulder. So isometrics are well, we activate the muscles without any movement. So it's important that when we do these ones, I want you to imagine pushing the shoulder downwards in each case. Okay, so first one we're going to look at is going forwards. So easiest to kind of do it against a surface. So again, we're trying to push the shoulder down, so you feel the chest engage and you feel the muscles just underneath the armpit engage, and then whilst you're holding that, you're also going to sort of push forward. Okay, so we're going to hold for about 10 seconds and then you can relax, and we do that again. So engaging the muscles in to pull the shoulder down and pushing forwards. Okay, so we can do that 3 times, and we're going to do that several times a day. That just starts to build some stability back into the muscles around the shoulder. Okay, so next one is going backwards. So again, engaging the chest muscles, so you're pushing shoulder downwards, and then you're going to push backwards. So you might find it helpful to push against the wall, but I'm pushing against my own hand for demonstration purposes. Okay, you're going to hold for 10 seconds, again relax, give it a bit of a rest, and then you're going to repeat for 3 repetitions. Next direction we're going to look at is outwards. Okay, so same idea. What we're doing is engaging the muscles, and then we're pushing outwards here. Okay, you can push out. You may find, if you haven't got a surface, you might just find pushing against your own hand enough. Okay, again, same sort of thing. Hold for about 10 seconds, 3 repetitions, and the next direction is inwards. Okay, so we've done forwards. Again, making sure we've engaged that shoulder down, then forwards, backwards, out, in. And what we're going to do is resisted rotations as well. So if you hold at the wrist, again making sure that this shoulder is pulled down and pushing outwards here, and the last direction is inwards here. That engaging engaging of the shoulder down is really important, because if you don't, what happens is you can irritate some of the tendons around here, causing the ball of the arm to come up towards that shoulder blade. Okay, so that's why we really engage down. Okay, so those are 2 exercises for you to have a go at when your shoulder is particularly acute.